welcome to another Healthy Living Resources Short. I'm Amy Meehan, the Healthy People Program Specialist with OSU Extension Family and Consumer Sciences. Today I have joining me Dr. Myriam Shaw Ojeda, who's a pharmacist with OSU, to talk with us about commonly asked questions related to vaccine side effects for the COVID-19 vaccines. Thanks so much for being here, Myriam. We'd love to hear more.
Thanks for having me today, Amy. Like you said, I'm a pharmacist and I serve as an assistant professor at The Ohio State University College of Pharmacy. I also serve as the Director of Pharmacy Extension and Public Health Initiatives at OSU Extension. Let's talk about some of the most commonly asked questions on side effects related to the COVID-19 vaccine. One of the major questions I receive is a question on fertility. If I get the COVID-19 vaccine, will I be able to have children, whether I'm family planning for today or seeking to have children in the near future? And my answer to that is, there is no evidence that people who get the vaccine will lose their ability to have babies. And this is for both men and women. Many people, in fact, have become pregnant after getting the COVID-19 vaccine, and the numbers are there to back this up. About 4,800 people have had a positive pregnancy test after receiving the first dose of an mRNA COVID-19 vaccine. That includes both Pfizer and BioNTech's vaccine and Moderna's vaccine. Another report that used data from about 8 U.S. healthcare systems documented more than 1,000 people who completed the COVID-19 vaccination before becoming pregnant. So all the data points show us that individuals who seek to have children in the near future can get the vaccine safely, can be protected against the pandemic, and safely plan for their family. Another side effect that we get a lot of questions about is myocarditis. Myocarditis is the inflammation of the heart muscle. It is treatable and can be caught. Now, I want to acknowledge that this is a side effect that has been seen more commonly, but what happens if you do get one of these symptoms? What happens if you do get myocarditis? Of course, the first advice that I would give is seek medical care. If you have heard of family members or individuals close to you who have had myocarditis related to the vaccine, reach out for medical advice as you consider whether or not you should get the vaccine or a booster dose, because more than likely your healthcare provider can give you evidence-based advice on the timing of when to get the shot and how it can affect your overall health. And lastly, a lot of folks ask me about the risks versus benefits of getting the COVID-19 vaccine. And my comment back to them is, a lot of the risks are there and very present, but the benefits of getting the vaccine outweigh the risk of potentially being hospitalized or even passing away from this disease. Ask yourself, who are your trusted circle of advisors? And of course, I'm biased by saying this, but pharmacists are one group of individuals who see the patients the most. Most patients come in at least once a month to get their medications. Pharmacists go through up to 8 years of training to learn all about medications and learn about disease states in general. And we're committed to providing you evidence-based information. So look up your sources of information. Hopefully a pharmacist is one of those sources, and consider whether or not the benefit of having the COVID-19 vaccine outweighs its risk. And my recommendation to you all is that it does. If you have further questions, feel free to reach out.
Thanks so much. For more information, you can contact either of us directly. Our contact information is below. And as always, reach out to your local extension office. Thanks so much.